Hello, I'm Irma Jordan, and welcome to the Frontier Nursing University virtual NP event celebrating family nurse practitioners. The group of family nurse practitioners joining me tonight are going to be sharing with you their love of nursing, their dedication to providing quality care to their patients, and their view of the role of NPs in our healthcare system, and more importantly, how they are helping us educate new nurse practitioners. Let me introduce myself first. I'm Irma Jordan. I'm a nurse practitioner who is duly certified as a family nurse practitioner as well as a psychiatric nurse practitioner. I've practiced as an APN for almost 20 years, graduating from the University of Tennessee Health Science Center in 1998. I am currently employed as the clinical director for family nursing and psychiatric nursing at Frontier. Gina Dabney. Gina, hello. Graduated from Northern Kentucky University in 2001. Ms. Dabney has practiced in a variety of family practice centers in the Richmond and Lexington, Kentucky area, and currently is employed at the White House Clinic in Richmond. This is a federally funded clinic providing primary care to patients across the lifespan. Ms. Dabney has been a preceptor for Frontier Nursing University, sharing her love of practice and teaching with many of our students through her 15-year MP career. Jahida Vasquez graduated from the University of Southern Florida in 2008. Ms. Vasquez has practiced as an adult nurse practitioner in the Southwest Florida area and has served as adjunct faculty at the University of South Florida College of Nursing. Ms. Vasquez Ms. Vasquez, by her own history, is uniquely qualified to address her patients' needs, and I hope she will share some of that with us. She is the owner of Suncoast Medical Center in Southwest Florida, serving patients who have difficulty navigating the healthcare system, as many are indigent and for whom English is not their primary language. She is currently serving as a Frontier Nursing University preceptor. Dr. Anna Loiseau is a graduate of the University of Louisville, Spalding University in Louisville, and Frontier Nursing University in 2015. She is certified as a family nurse practitioner and has 17 years of nursing experience. She has served as a direct graduate student preceptor for over 20 students and has served as faculty with Frontier Nursing University since 2015. Her role as clinical preceptor and faculty is in managing clinical rotations for students in the Florida area, and I think this makes her uniquely qualified to address some of the topics of our conversation here tonight. So welcome, ladies, and I'm glad to have you with us.
Thank you.
Thank you.
Thank you.
And what we were going to start off with is just some questions. I've talked about y'all a little bit, but I was hoping that you might tell me a little bit more about your general location, where your practice is at, and about your patient population that you serve. And Anna, if you don't mind, Gina, if you don't mind, would you start for us?
I currently work, as you said, in a federally qualified rural health center in Richmond, Kentucky. It is about 20 miles south of Lexington. We have quite a large population in that we serve a lot of the surrounding counties that don't have access to health care. And we mostly serve the underserved. And we also, with being a rural health center, have a sliding fee, so we serve a lot of people that don't have any insurance at all. And we do serve the population of birth to death. So we have, peds as well as, young adults, middle-aged adults, and many older adults as well. So we serve all of those age spans. And we have family practice like myself, and we also have pediatricians in our practice as well. We have licensed care social worker. We have our own pharmacy, and we have our own dental facility. So we can provide a lot of different services to our patients in need, which is, as you know, very important They don't have to go to several places to get all the care that they need. They can get a lot of it just right with us at our clinic. We have a couple of nurse practitioners. We have a few DOs on staff, a few MDs, and then we have pediatricians as well. So we have a wide range of staff, and we're one of many clinics. There's another one in Irvine, Kentucky. We have two in Berea, one in Mount Vernon, and one in Paint Lick. So we have several other clinics close to us that families can access as well. It's a very important clinic, I think, for us to have. We serve quite a range of people with various needs, from acute to chronic care to preventative care.
All right. So Jahida, I'd like to start a little bit different aspect with you. I understand from being in your clinic that you have a special story that touched your heart and made some life decisions for you as far as becoming a nurse practitioner, and then ultimately ended up in you buying the clinic or establishing the clinic that you now own. Would you care to tell us a little bit about some of that?
Of course. Yes, I have a personal history of having been homeless when I was a teenager. And I always had that in my heart that when I got out of that situation and I wanted to go to school and do some things to help the community again. So what I did was I joined a local community center, health center in the area, and I became their person to help them with their health care for homeless program. And I was just a lay person. I helped with anything that I could. But in doing that, I met a nurse practitioner. And that was the first time. I didn't know what a nurse practitioner was. I had never heard about nurse practitioners before. But I was completely fascinated by just everything that she was able to do, how she was able to take care of her patients. And I knew right there and then that that's what I wanted to do. She encouraged me to go to school, first nursing school, and then from there, and to date, she's still a good friend of mine. So I just love that she's been a part of this whole history and everything till now. Since then, I've worked in different practices, and in that, I identified a lot of the challenges that a lot of the populations that I like to work with were having, specifically the Hispanic population. And so I just wanted to have a place where they had someone that spoke their language, understood their culture, and that prompted me to start my own practice in a rural area where I found a need, a great need. It's an area called Lehigh Acres here in Florida that is close to where the bigger city is, but also real close and connected to areas where people work in the fields, and so that was a good place where they can come. And I opened that practice in 2014.
All right. And Dr. Lazo, can you tell us a little bit about, I know most of your time is taken up as a Frontier Regional Clinical Faculty member, but I know you also practice.
Yes. As you said, I am a regional clinical faculty for the state of Florida. However, I am from Kentucky, moved down here to Florida about a year ago. And I just love my work so much in Kentucky that I kind of fly back home every month or so and work a few shifts. And right now, actually, I'm working at an urgent care center that's owned by a hospital, but I also worked for that hospital in a family practice setting for about 15 years. It's kind of a small town community near Fort Knox, so there's a lot of military people, and just a wide range of all kinds of people there, and I just really like it there. So I go back quite a bit and work there when I can. And then the rest of my time, I'm down here in Florida loving my role as a regional clinical faculty down here.
Well, and that starts off kind of, you know, first off, we as nurses assume many roles. And I think when we became advanced practice nurses, those roles even expanded more for us. So we're clinicians, we serve roles in our community, and you are one of our regional clinical faculty there in Florida. Can you tell us a little bit about your experience precepting students, and then how that experience has translated for you in being the regional clinical faculty down there in Florida?
Yes, I started precepting, I'd say about 2 years after I became a nurse practitioner, and I started out precepting for the university that I attended, Spalding University in Louisville, and then I expanded to other schools, and I just really loved teaching the students. They just seemed to soak in all the information, and they just love learning, and it was just a really rewarding experience. And I did that for many, many years. And I ended up meeting some students that attended Frontier, and that was my first experience with distance education. And I was amazed at how well prepared these students were. So I just became more involved, and it kind of turned into this role that I have now as regional clinical faculty, which kind of expands on the clinical precepting experience that I have, and I just love it. I get to have contact with the students on a daily basis and see them grow and learn, and it's just really rewarding. I really love it.
And Gina, if you might tell us a little bit, I know that being in a federally qualified health center with all different types of practitioners there, you've had many opportunities to serve as a preceptor. Can you tell us a little bit about, you know, why you do this? Because I know it takes time, and it takes it added workload on you there in your busy practice.
Well, I had trouble all throughout my schooling getting good preceptors, and I vowed that when I got done, I would definitely give back and take on students as much as I could. I didn't want them to go through what I had gone through. I felt like that there should be plenty of other providers out there willing to take and to share their knowledge and to help and do whatever they could do. And that, you know, the only way that I could ensure that was to do that myself. So I vowed from then on that I would take students as much as I can, and I have done so. But, you know, it's not just what, you know, I can teach them or what I can do for them, but I learned a tremendous amount from the students, and they keep me updated. A lot of times they will get current guideline updates before I will, and so I rely on them a lot to help me. It's so hard these days to keep up with all the current information that's out there. I rely upon them a lot to help me as well. So it's a mutual relationship there, and I tremendously enjoy it.
I know when I precepted, that was one of the things that really I found so enjoyable, is that you were constantly challenged by those students coming in, and you really had to up your game. It was not, you couldn't do the same old, same old. You had to know the latest evidence-based practice so that you could keep up with the students, but also that you were providing that care to your patients. So they are challenging to, in a good way, challenging to be able to work with them. So Jahida, I've been to your practice. It's a busy practice. And I know that you have precepted for a while. Why do you do this?
You know, the same thing that Gina shared. I had I went to a school in Tampa, And I would travel there to go to school, and then I did my preceptorship here in my area, so it was 2 hours away. And so it was difficult to find preceptors and good ones. And I said the same thing that she did. So that's why I was smiling throughout what she was saying, because I said, I don't want to put people through that same challenge. So I'm gonna do the same. And I've been precepting since 2010 every single semester. And every semester I say, it's time to hang up the hat for a little while, and it just never happens. I just get another person and another person. I don't know. It just feels wonderful right now. Actually, I can tell you so many of the nurse practitioners in this area that have been through either my practice or have worked with me, and so it fills me with pride, because I take this very seriously, and want to build up colleagues that are well prepared to take care of all of the health challenges that we have out there. So for me to be a part of that, just to know that there's a little seed that I was able to plant, and if someone that they can take that and grow it in their own way, that just fills me up with joy. And so as much as it can be hard, as everyone knows, that's a part of this, that's done it before. Yes, it delays you, and not every student is successful, and sometimes that can be something that brings you down. But just you stick to it, and then to hear their success stories later, just when they call me and tell me I got the job, and my name is on the door, and or I passed the test. I don't know. It just truly, like I said, fills me up with joy to see just that extension in me. It's just that legacy. So after I'm gone, there'll still be a lot of mini me's out there.
I'm sitting here smiling because the logo for Frontier is a banyan tree, and banyan trees send out, and you use the word extensions for the tree, it's roots, and those roots spring up new trees, and they go on forever. And that's your description of why you do it really fits just with that logo. Ladies, tell me a little bit, there's a lot of changes going to come down the pike with healthcare and the role of the NP in providing that care. I know many states are looking at how the nurse practitioners can practice to the full scope of their education. Can you briefly tell us a little bit about how you feel the role of the NP is used, or could be better used, in providing health care to your populations? Gina, why don't we start with you this time?
Can you hear me?
Yes.
Okay. I have a few barriers, even though I work with several other providers that obviously we probably all have encountered at one time or another. But there's certain things that we cannot do solely here in Kentucky that presents problems for patients. Our physician's going to be leaving, and then it's going to leave us with all nurse practitioners, which should be fine. Unfortunately, there's certain things that we can't do. We simply can't fill out diabetic shoe forms, and that is definitely a barrier because most of our patients are diabetic. And then home health orders we are unable to sign, and we have several patients that access home health, and it's very important that they get these services. So I feel like that there are several things. Of course, I know that we have been trying to get these approved for years, but it's definitely barriers, and you get further out in rural counties, and there's not that many physicians anymore going into family practice, that we are just going to be limited more to nurse practitioners providing complete and total care. and we need to be able to have all privileges, including those areas, to be able to help these people to the best of our ability and get them total quality care and access.
So
I
true.
hope that we can, in the coming years, get somewhere with these issues and get some privileges for these.
And Jahida, I know you also work in a state that is a little bit more restrictive. We are all here from the Southeast, and it poses issues and problems for us. And I think a patient population that is traditionally underserved and maybe marginalized by our system also provides you with some challenges. So how do you see your role in providing care for your patients?
In my area, I've done a lot of education about, first of all, what nurse practitioners are. So that was barrier number one, because there is no official title for nurse practitioners in Spanish or in other languages. So that's one of the first things. So my role has been in a lot of education and what the role is, not just with the patients, but also even with the other providers, the doctors. Like I have obviously a collaborator here in the area. I've made my doctor, that's my collaborator, my partner in my business, in order for me to be able to do a lot more things and expand in some of the services. Because if not, then I'm limited there, which is another barrier. So I was real blessed to meet someone that wanted to be a partner with me in that endeavor. But that took a lot of teaching for that as well. I have been teaching a lot, again, on what our scope is. All of those things that we can do and that we can do well. There's a big misconception about what we can do, and like I said, not just with the patients, but with even the doctors and other providers too. So that has been my role. I'm seeing some things coming to fruition. Like you probably know now, we're have the controlled substance issue here taken care of as of 2017. So we'll be able to prescribe. That's one less barrier. Like Gina mentioned, we have the same other barriers here with durable medical equipment and such. So I'm hoping to see those changes in my time. But if I don't, then I see my role with my patients, just continue to be the best provider that I can, not to worry about the titles and what I can do. Just do what I can do very well, and that's take care of them to the best of my ability, and continue to teach about, again, what we can do and cannot do, and hopefully that will open up a lot more doors for us in the future.
And I think you really spoke to the part about as we educate new nurse practitioners, many of them are going to have a much, much longer practice life than we will. And impressing upon them the need for them to become involved, to get involved at the state level or the national level, so that nurse practitioners can practice to the full extent of their education. And we are about quality, affordable health care and access for our patients. So, and I think that resonates with all of our preceptors and NP colleagues across the nation. Ladies, I want to thank you so much for joining us tonight. I do appreciate the time you've taken out of your busy schedule and home life to share some of your thoughts about being an NP, being a preceptor for NP students, as well as just about the role that you serve in your community. To those that are listening, if you would like to know more about becoming a preceptor for Frontier Nursing University, I would like to encourage you to email me. My email address is irma, IRMA, .jordan, JORDAN, @frontier.edu. And if you happen to be listening to this and want to think about coming back to school, either for a second certification or for our DMP program, if you contact me, I will certainly put you in contact with the right people. So I thank you for joining us this evening and look forward to hearing from you soon.
Thank you.